National Cabinet has agreed to fast-track vaccines for the over 50s in hope of speeding up Australia's stalled rollout.
For more, we're joined by Federal Health Minister Greg Hunt in Victoria. Good morning to you, Minister. Given what's happened, there have been some changes, haven't they? Have you got control of this now?
Look, we do, and I think what we see is the fast-tracking of vaccinations for over 50s, for those that haven't caught up. From the 3rd of May, some of the states, the states and what are called the Commonwealth GP respiratory clinics, or the Commonwealth large vaccination clinics, will be offering over 50s vaccinations, and then from the 17th of May, general practice clinics, and at the same time fast-tracking the ability for the rest of the 1A and 1B groups, people such as disability workers, aged care workers who are under 50, to access state Pfizer clinics. So all of this is taking it forward. We had medical advice, we've made changes, and this is what's kept us safe. There were 880,000 cases worldwide yesterday. There were none in the community in Australia, and just imagine that, 880,000 cases versus zero. So we're in an incredibly strong situation. We're now at over 1.8 million vaccinations, but this allows us to fast-track over 50s and under 50s.
Even just listening to you sort of explain that there, it is very confusing for people, and I think when the goalposts move, which obviously they have to with supply issues and what happened with AstraZeneca, but even just reading the paper this morning that you have health staff avoiding getting the AstraZeneca jab, that doesn't exactly make those over 50 feel confident getting it, does it? Well,
I'm one of those that's had the AstraZeneca jab. I went with Julia Gillard and Brendan Murphy, and we did that. We did that, because we believe in it and wanted to show the demonstration. B, that's just part of people being vaccinated. So our job together is to provide that confidence, and this is what is going to protect us and save lives. It's about helping each individual, but each of us also has the chance to protect every other Australian. And that's been put to me by people within the community, and I think it's a lovely way to conceive of it, and I think it's a very accurate way that every person's vaccination protects them, but it helps protect everybody else.
It is painfully slow, though. Look, 345,000 doses a week. We can expect to reach 40 million by, what, June 2023?
No, with respect, what happens is that we get to the point where we double the AstraZeneca doses with the second doses. That's a 12-week gap between first and second on the medical advice. In addition to that, we have a very large increase in Pfizer in the latter part of the year. And so we work through this. We've multiplied by 7-fold the number of vaccinations in a 4.5-week period since the general practice rollout came on board. And rest of the world, a raging global pandemic. Australia, an island sanctuary at the same time. We're pushing forward with these vaccinations as quickly as possible, but always as safely as possible. And the medical advice did change, and that did present a challenge. But I tell you what, as Australians have done, we've risen to that challenge right through the pandemic.
Minister, look, just looking at National Cabinet yesterday agreeing to restrict travel to and from India. We know that 40% of COVID cases in Australia in quarantine are from India. Why not just halt all flights? Because unfortunately what's happening over there, it is completely out of control.
Yes, look, India is going through a terrible agony at the moment. And we have two roles. One is obviously first and foremost to protect the country. Secondly is to help bring Australians home. And so, commensurate with that safety, the medical estimate, which was agreed by National Cabinet, was to reduce by 30% the number of people coming on government-sponsored flights, and to reduce by 30% the number of commercial flights. That's in line with what we believe the hotel quarantine system can safely bear. But if that needs to be reduced, we won't hesitate to do it. We did that last night, and we'll do it again if necessary. Of course, we've had to make changes in relation to PNG and the flights from there at different times. And so we have a process to assess risk, but we've got a hotel quarantine system which is, I think, as good as any in the world, and I know that when Britain was looking to set up their system, they turned to Australia. So we're always adapting. Last night we adapted on the basis of exactly as you say, the case numbers in India. We think of the people in India and the terrible agony they're going through. At the same time, we have to bring Australians home, but keep Australians safe.
Okay, thank you for your time today. Really appreciate it. I know on the Weekend Today show, you're encouraging anyone over the age of 50 to get AstraZeneca. We've got the prime candidate in Richard Wilkins. We look forward to you administering him a jab over the weekend.
Well, you'd rather not me do it, but we can arrange a doctor if Richard is happy to do it on air. I reckon that would be a great
You're more than capable, Greg. More than capable.
There may be some problems with that. We'll arrange a qualified nurse or doctor.
Okay, we'll do that on the weekend. Good on you. Thanks for your time.
Oh, poor Dickie. I'm assuming you haven't asked him.
No, he doesn't. He doesn't wake up until 9. It's very rock starish.
Hotel quarantine system is on a knife's edge as highly infectious COVID strains spread within their walls. President of the AMA, Dr. Omar Khorshid, joins us now in Perth. Thanks for your time this morning, Doctor. I know that you met with National Cabinet yesterday. The number of return travellers from high-risk countries will be slashed. Let's talk about India, because India is a huge problem. 40% of all positive cases in hotel quarantine. Should we be halting all flights from India for a short period?
Morning, Ali. What the government have done is taken a risk management approach. They've recognised that India is producing a significant amount of risk to our hotel quarantine system, but they're balancing that against the need for Australians to be able to come home, their right actually to be able to come home, and the capacity of our system to deal with COVID positive cases. What we do need to do is make sure the quarantine system can actually deal with positive cases to avoid transmission between the residents in the quarantine hotels and, of course, most importantly, to avoid letting that virus get out of the quarantine system into the community.
And look, this is the issue, what's happening in hotel quarantine. And I feel for everyone in India right now, for people, obviously a lot of people in Australia who have family over there. And you don't ever want to say that you're not going to allow certain people into the country for a certain period of time. But we are seeing this spread within quarantine hotels, within New South Wales and in WA. Do you think that ventilation and airflow is an issue?
The most likely explanation for how this virus can spread between different rooms when people have been completely isolated is airborne spread, and therefore the ventilation of these hotels, the way that people are separated, and the amount of personal protective equipment and the type worn by the quarantine staff is all absolutely critical. The other factor, of course, is we need to see that all the staff are actually vaccinated, because we know that vaccination reduces the risk of catching COVID and, of course, spreading it through the community.
And so it's a real concern when we read this morning that you have healthcare workers refusing to get the AstraZeneca jab. How are you going to have confidence in it if our frontline workers don't?
Now, we have a lot of confidence in the AstraZeneca vaccine. The stats speak for themselves, and the risks associated are so vanishingly small it's actually hard to get your head around. So it's a confidence thing, and we're really pleased to see that our state and federal governments have indicated their confidence in the AZ vaccine by rolling it out to everybody under 50 in the coming weeks, meaning that any Australian in that age group can go to their GP, get the AstraZeneca vaccine. And for those under 50, the state systems have opened up. They will be offering the Pfizer vaccine to healthcare workers initially under 50, but then, of course, the rest of the community as we get more vaccine supply in coming months.
But look, I think it's all fine for our governments to have confidence in this, but we're just hearing from the New South Wales Health Minister this morning saying 70 to 80% of health staff who were booked to receive the AstraZeneca jab didn't attend over the past couple of weeks. That's a big concern.
We have hit a dip in the public confidence in AZ due, I think, to very significant concerns in the community and, of course, within our healthcare worker community around the safety of the vaccine. But we have the best people in the world looking at it. Every country has looked at it. The stats are in, and they show that the risks are vanishingly small and the benefits are actually really large. And we need to remember, COVID is coming to our country one day, and if we're not vaccinated, we are at risk. And that could get out, as you just mentioned, through hotel quarantine with people coming from overseas, or it could get into the community in months and years to come when we open back up. But it is coming, and the only way to avoid it is vaccination.
Yep, that is so true. And we've just heard from Richard Wilkins this morning. Karl put him in it, and he's agreed to get his AstraZeneca jab live on air. So we might try and organise that for this weekend. Thank you, Dickie.
Sounds like a good idea.
It is. Thanks, Omar. You enjoy.